Assalamualaikum and good day. I am Johara Adtha and I'm going to answer the two questions that I chose. So the first question is the challenges that you might encounter in caring for patients with diverse cultures. So for me, the challenges that I might encounter in caring for patients with diverse cultures are their faith and religious belief, and also having cultural and language differences that might create barriers. So when cultures and languages create barriers, we nurses are unable to deliver the care we have been trained to provide care for our patients. So, culturally competent care depends on resolving systemic and individual cultural differences that can create conflicts and misunderstandings. So, if we nurses are unable to elicit patient information and negotiate appropriate care, negative health consequences may occur to the patient. So another thing is one of the most common cultural issues that arise for nurses involves faith and religious beliefs. So there are certain religious groups that might refuse prescription medications, blood transfusions, surgeries, or other potentially life-saving treatments because of their religious beliefs. So nurses may struggle to understand these beliefs and may disagree with the patient's decision to decline treatment, which is why developing sensitivity towards various religious beliefs is so important. And take note also that in caring for patients with diverse cultures, we must have the ability to understand and interact effectively with people from other cultures. So we nurses must be able to understand how each patient's socio-cultural background affect health beliefs and behavior. So by understanding the patient's social determinants of health, we as a practitioners are better able to provide care to our patients. So some of the things that we should do in caring with diverse cultures are to have an awareness and avoid making assumptions to our patient, respect patient to build trust, learn about other cultures, overcome language barriers, educate patients about medical practices, and practice active listening, because it's important that patients feel heard and validated, particularly when they are in a vulnerable position. Thus, nurses should be aware of cultural differences to provide culturally competent care. So the second question is the importance of cultural assessment in rendering culturally competent care to individuals, family, and community. So cultural assessment is being used to understand about culturally entrenched norms and values, as well as behavioral drives and existing characteristics. So this evaluation looks specifically at numerous aspects of culture, such as the environment, traditions, social interactions, incentives, and values. So we nurses should ask about the background, religious preference, family patterns, food preferences, eating patterns, and health practices of the patient. So the importance of this in rendering culturally competent care to individuals, family, and community is that it adapts care to the patient's cultural needs and preferences. So, starting with a cultural assessment that serves as the foundation for the care plan. So, nurses who examine their patients' cultural ideas, attitudes, and behaviors are better equipped to provide care and achieve positive outcomes. Additionally, the importance of this are it helps the nurse to understand, communicate, and interact with patient effectively. Second, it prepares to empathize, relate more to patients, and attend more deeply to their needs. Third, it encourages the acknowledgement and acceptance of differences in appearance, behavior, and culture. And fourth, it helps the nurse to offer the best services to every patient, leading to high satisfaction and care on the side of the patient. So by this, healthcare workers give the best medical care to patients while demonstrating cultural awareness for their beliefs, race, and values. So that would be all. Thank you.